I was just wondering, I know doctors want us to lower cholesterol as low as possible, but is there a time that it becomes too low?
No, that's really not. I mean, like it's impossible to get it too low. Essentially, it's good that you try to lower the cholesterol, which is high, but when it goes into a certain range, then the body reacts itself, because the cholesterol also is important for. I mean, it's not like only bad. It's important to have the right amount, so it doesn't go too low, because it's impossible to send it too low. It's because the body reacts by burning more stuff, so it's very difficult to go too low. It's not like sugar. Sugar with diabetes, like you can go. For example, if you take insulin, it could be that it goes too low, because and then it could be a dramatic position you're in, because it could be like you can go even to coma with too low sugar in your blood. But that doesn't happen with cholesterol. So be sure that all the drugs that you take, of course, are let's say balanced on your cholesterol level, but no worries about having the cholesterol too low.
Okay, I just wanted to ask another question regarding that. Like in Canada,
Sure.
the levels for LDL cholesterol are acceptable range for them are 1.50 to 2.65. But my latest one, it said 0.68, and they flagged it because it was so low. So you're saying that I don't need to worry, even though it's way below the guidelines?
Yeah. I mean, like it's not a big drama. I mean, you talk about LDL or HDL.
LDL.
What about the HDL?
My HDL is a little bit low.
Okay, it's fine. It doesn't really matter. No, I mean, actually, you're in a good situation. I don't think there's any issue with that. Did someone tell you that there's an issue with that?
No, I haven't seen the doctor yet. I don't have another appointment for a couple of weeks, right? But I was just wondering, since it was so low, could I back off on my cholesterol med a little bit, or should I
Ah, of
just leave
course.
it?
Sorry. Yeah, I didn't know you were on a cholesterol man. Yes, of course. I mean, it's like the less. I mean, usually speaking, the less drugs you take, the better it is. So essentially, if you can get out from the cholesterol pill, then it would be good. Do you have PAD?
Yes.
Okay, because that's the other thing. Like usually, because I mean, it's a bit complex to explain. But the pill for the cholesterol doesn't only lower your cholesterol. Okay, also makes the plaques that you have, especially in your heart, more stable. It means like it creates a plaque which is more solid. It doesn't increase or decrease the size. It just changes the way the plaque is formed. So if you have a more stable plaque, that means less chances of this plaque to go around and potentially cause more damage. There's less chances of this plaque get ulcerated and to create thrombus and eventually blockage. So with PAD patients who always have also some even minor or like, of course, silent cardiac disease, it's also important to get the cholesterol med, not only for just to lower the cholesterol, also to make the plaques more stable. So I would say talk to your doctor, and essentially you can, the best is not to talk even to a vascular doctor, to talk to, let's say, a general medical doctor, like the ones who are managing the drugs, and like a general medicine doctor, and ask what they think. And you can also try to lower your, for example, I don't know, you take, I would say atorvastatin 80 milligrams, you can go to atorvastatin 40 milligrams and check how it goes. The same with the pills for the blood pressure. You get the pill, you try to adjust, and you see how it goes. So this is there's no rush in doing that. There's no danger having the cholesterol too low. So take your time, but it's a conversation you can have with your doctor. Yes.
Good
Thank you
question.
very much for your answers.